Hello, everyone. Good afternoon here in Singapore. Good morning, good evening to those joining us from other continents. Welcome to this new edition of our Conversations in Planetary Health series, brought to you by the SingHealth Duke-NUS Global Health Institute, which is part of the Duke-NUS Medical School based at the National University of Singapore. That's a long name. And I'm Renzo Ginto, Associate Professor of Global and Planetary Health. I also lead the Planetary Health Initiative of our institute. And again, thank you very much for taking time to be part of this very important conversation. As you know, we in SDGHI are building our capacity and portfolio in this new field of planetary health. We are now facing many different challenges, ranging from climate change to loss of biodiversity to pollution to the air, water, and land. And all of these will have grave implications on the health of human populations, not just today, but in the future. And that's why we in Duke-NUS Medical School, we're trying to prepare the next generation of physicians and health practitioners who will care not only for the health of people, but also for the health of the planet. And that's why we're having all these out-of-the-box conversations, things, issues, perspectives that we don't often hear inside the hospital or in a medical school. And today is very special because we are actually organizing this session in collaboration with another new kid on the block of the Institute in terms of our signature programs. It's the Global Mental Health Program. And with me to co-moderate this episode is Dr. Anne-Claire Stona. Anne-Claire, thank you very much for joining us. And yep, why don't you introduce yourself very quickly and also briefly about the program?
Yeah, good afternoon, everyone. So very happy to be here and to collaborate with Benzon on this session. So my name is Anne-Claire Stona. I'm an assistant professor and I lead the Global Mental Health Program at SDGHI. And really the aim of the program is also to raise awareness about mental health, build momentum around this topic in Asia, and advance regional progress. So through capacity building, research and networking. So we host the Asia Hub of the Mental Health Innovation Network together stakeholders from the region and to promote knowledge sharing, raising visibility of existing innovations on mental health. So feel free to join the network. Membership is free, and we can share the link of the network. And so very happy to collaborate with Renzo. I think it's our first concrete collaboration, and very happy to share that this will be followed up by an event in February next year. So as part of the Global Mental Health in Asia 2025 Symposium, we are organizing a full-day program on climate and mental health. So if you want to learn more about this topic, feel free to also join. We have a column for abstract available, and we can share the web page for the event.
Brilliant, very exciting. And Anne-Claire, again, thank you very much. This is just the first of our many collaborations. We have that upcoming event in February, and later on, Anne-Claire will be helping me moderate, the Q&A conversation with our guest speaker. Before we proceed, I just want to acknowledge first my colleagues who are in the room, and we're also going to enjoy some very healthy and sustainable lunch shortly. But for those who cannot access the lunch that we have, you have food for for your brains, right? Through this conversation, we have around 60 plus participants joining us virtually. Hopefully more are on their way. And we are recording this session. We will put this in the YouTube channel of the Institute, which has many subscribers, many learners and scholars and practitioners from across Asia and the world are actually watching all these conversations even after the event. So now let's not keep this too long anymore, an introduction. And you all came here to listen to our main speaker. And our guest now, the reason why he's in town is because this week we also launched our inaugural week-long intensive planetary health course. As part of our graduate certificate for global health in Asia. And, it's already day 2. We have students from across Singapore, but next year we want a very Asian class with a very Asian faculty because, our institute has a strong Asia focus. And for the session on climate and mental health, we actually brought in one of the leading voices and scholars in the nexus of climate change and mental health. He is, the first and only, I think, environmental psychologist of the Philippines, which is my home country. And this person is really my partner in crime when it comes to, things related to climate and mental health. And so I will not anymore keep this long. And let's give a big round of applause to my dear friend, collaborator, and comrade, Professor John Aruta. Welcome to the Duke-NUS Medical School.
Thank you very much, Renzo, for the generous introduction. Thank you as well, Duke-NUS, for the invitation. Really appreciate. My name is John. I have a very long name. Sometimes people call me John, sometimes Benzon. So you choose.
Aruta.
Sometimes Aruta. You're correct. I'm an environmental psychologist, which means I use psychology principles in promoting environmental sustainability. I am also a counseling psychologist by training. And in the past 10 years, I've been also involved in providing mental health intervention support for young people, children, and early adults in the Philippines. I've been practicing clinically in the Philippines as well in the past 10 years. Currently, I am based at De La Salle University in Manila, in the Department of Psychology. In this presentation, I'll talk about the emerging research on climate change and mental health. As a global South scholar, I also use my lens, whenever I talk about climate change and mental health. So I'll touch a little bit on climate justice. And I'll draw from some of our experiences in the Philippines in particular. And I think it's right to acknowledge that everyone is affected by climate change anywhere in the world, but climate change is a very unequal event where some people are more affected than others. Singapore may be more familiar with heat. Back home in the Philippines, we're more familiar with flooding, more familiar with typhoons. And Mother Earth already gave us a deadline that if we don't limit global warming by 1.5 degrees above pre-industrial level, that means before we industrialize globally, we might not be able to reverse climate change. If you asked me 1 month ago, we're already at 1.2 degrees, but based on the recent documents, reports that I reviewed just last week, we're actually, as we speak, at 1.45, based on some documents. So we're not on track to limiting 1.5 degrees by 2030 deadline. Because that means we need to reduce ecological activity by at least 50%, and that's not going to happen. And in the discourse of climate change and mental health, there's already a rich and ongoing discussion on how it impacts physical health. But there's very little discussion in the previous years on how they impact mental health. Because climate change and mental health connection often is not intuitive. There is very, very difficult to map. But fortunately, in the past 3 years, there's been an increase of climate change and mental health research. In 2019, for example, there's around 100 plus studies on climate change, mental health. Now it's times 3, times 4 number of studies in climate change and mental health. And one of the fundamental question is, how are they actually connected? Of course, this is an oversimplified slide. It's very much complex than this. But it can be direct. For example, in the Philippines, we experience typhoons, so you see a lot of people being traumatized, depressed, because of the direct impacts of typhoons. Bushfire in Australia, for instance, can trigger many different mental health problems. It can also be indirect. Unfortunately, the indirect impact is often invisible, insidious, but this pathway creates the biggest percentage of mental health cases. So for instance, sea level rise, as it happens to a country like the Philippines that has at least 7,000 islands, we feel sea level rise very much. And then when they reach the agricultural spaces of farmers, it's not anymore fitted for farming. They won't harvest, no food on the table. If you're a father, you can't send your kids to school. And imagine the mental health cost of that. So just again, this is an oversimplified slide, but we're we're learning now based on research and our projects that it's much more complex than this, of course. We know that climate change has many different mental health impacts like depression, grief, anxiety. So I'll show you some of the examples of evidence on the impact of climate change on mental health. For example, we know that typhoons and hurricanes are associated with many different mental health problems, particularly trauma, based on this systematic review. You know, the prevalence of trauma because of typhoon is just huge. Heat is also uh, very much a trigger of mental health and can exacerbate already existing mental health problems. We know that based on evidence. These are the some systematic reviews you can access. We know that the longer you are exposed to heat, the more distressed you become emotionally. We also know that there are evidence that long-term exposure to heat is associated with country-level rates of suicide and schizophrenia rate and psychiatric intakes. That's based on global studies and also multi-city studies, for instance, in Vietnam and in Japan. We also know that, a skyrocketing increase of suicides among farmers, particularly in India. Air pollution is also a threat to mental health. We're beginning to learn that long-term exposure, especially if you got exposed to air pollution since childhood, your odds ratio of developing schizophrenia risk increases by at least 2 to 5%. We also know that some of the mechanisms why air pollution is a trigger of mental health problem is because of the long-term changes, long-term effects to the brain, brain changes happening, because of air pollution. Of course, there are many evidence, but I'd like to focus a little bit on one of the buzzwords today. You heard about climate anxiety. We wrote a book chapter on climate anxiety. Conceptually, it's very difficult to define. We need to work more on this. But one of the general definition is your anxiety because of particularly climate change. Its impact on you personally, to your family, and in the future. You can also define climate anxiety as an umbrella term for these many different emotions. So if you feel helpless, afraid, grieving, sad, or hopeless, that can also be an umbrella. A climate anxiety can be an umbrella term to these many different emotions. And let me zoom into our region. Our region is one of the most climate vulnerable regions in the world because of its location. And in the region, the Philippines, you'll see that it's, the redder the country, the more vulnerable it is to climate change. The Philippines constantly would be in the top 5 globally. In Southeast Asia, we're the reddest. So we're the most climate vulnerable. We experience at least 20 typhoons per year. As we speak, there's flooding in many different cities in the country. There's typhoon right now. Can you guess how many typhoons would an average Filipino experience in his or her lifetime?
What's the life expectancy? You multiply.
Yeah, so it's 1,400 typhoons approximately. Yet, climate change discourse in the regional level, global level, there's very little inclusion of countries like the Philippines and how we develop interventions. This first global study on climate anxiety, it involved 10 countries, including the Philippines. They recruited children and young people in these 10 countries. They measured climate anxiety and many different emotions, and the Philippines has the most number of children and young people with moderate to severe levels of climate anxiety. If we look at many different emotions, we would sometimes, be like sadness, helplessness, anxiety, afraid. Philippines would often rank as number 1, sometimes number 2. Fortunately, we have a chunk of young people who are optimistic that climate change can be addressed. Many young people all over the world as well would feel angry, betrayed, guilty about climate change, betrayed in particular by their governments, the global government, and the previous generations. This is the voice of young people. And we published this paper in the Lancet Planetary Health, explaining why in the Philippines, young people and children are experiencing climate anxiety. We talked a little bit about education, its vulnerability, social media. But if you want to learn more about this is it's open access. You can simply, I will not labor you on this one, but it's downloadable. My partner in crime, Renzo, and I published a paper on climate anxiety in the Philippines. We describe potential pathways, why climate anxiety will be experienced by different groups in the Philippines. We argued that climate anxiety is not a uniform experience, but it can be a diverse experience depending on where you come from, your status in life, etc. It's open access as well, so feel free to access this one. But one thing I want to emphasize is that while we're talking about the mental health cost of climate change, that it can sometimes lead to clinical level mental health disorders, climate anxiety and some of these emotions associated with climate change are normal emotions. They are valid because climate change is real. It's already happening, devastating people's lives. And it's only normal and adaptive for us to react emotionally. So if you feel anxious about climate change, it's okay. You're fine. As an environmental psychologist, I'm more worried if you don't have any emotional reaction despite climate change happening. But what's important is that we need to reflect and realize how we can translate all these emotions into action at an individual level, community, and collective level. For instance, we learned in one of our studies based on young Filipino samples that young Filipinos who experience climate change would experience climate anxiety, then therefore engage more in climate mitigation behavior. Of course, there are limitations to this, but in general, we're learning that climate anxiety can be a precursor of climate action. But while we're saying that climate action is important, not all places are friendly in terms of climate action and climate activism. There are countries like the Philippines where there's this massive number of murders of environmental defenders, human rights defenders, and climate activists. The Philippines, for instance, along with Brazil and Mexico, are the top countries in terms of number of murders against climate activists and environmental defenders. So it's a very tricky place to do climate action. For instance, these two young women, environmental activists, they're protesting against the reclamation area in Manila Bay. And then one day in September 2023, they gone missing for 2 weeks. And then suddenly there's a press conference with them at the center. And then these two brave young women environmental defenders in that press conference live very bravely said that it was the Philippine military who actually abducted them and told them to, tell it in the press conference that they were not abducted, they were taken care of. But so they were very brave. And after that press conference, they were taken by their families. But these are just examples of how difficult it is to be an environmental activist in the Philippines. I'm telling this because one of my research area is the mental health of environmental defenders. So I will touch a little bit on climate justice because this is one of my main motivation in working in this space. Let me just check the time very quick. Climate justice is very complex. The definition of climate justice depends on who you ask. But one rough definition is who mainly causes climate change and who are facing the brunt of the climate crisis. Let me just very briefly explain. In this slide, you'll see that countries highlighted with blue are global north countries. Usually they are developed countries, countries that emit top CO2.
Do you know why we're laughing?
Singapore is
Yeah.
But Singapore, they really drew
yeah.
the curve.
Singapore is tricky because one of the characteristic of global north countries is that they are colonizers, right?
They're
So
not
tricky. Singapore is tricky. Global south is highlighted with red. Of course, this is a very rough description, right? Often they are developing countries with very minimal contribution to greenhouse gas emission, and often they are colonized. You see the top CO2 emitting countries from 1750 to 2020. Of course, the US historically is top emitter, right? China and India, of course, currently are top emitters, but they can argue that we're only using our carbon footprint just now. Historically, it's really the US and European countries. But and you'll see, despite the minimum contribution of global south countries in terms of mental health, young people in the global south have greater symptoms of mental health problems. In the Philippines, for instance, if you remember Typhoon Haiyan, the strongest typhoon ever hit land, killed at least 6,000 people in my country. Thousands of people and families were displaced. In terms of economic losses, it's roughly 12 to 15 USD billion. That doesn't include recovery. And when we talk about climate change, we cannot forget the colonization, because the idea of colonization is colonizers take the resources from colonized countries. And the Philippines, since 1521, 1565 officially, was colonized by Spain for 333 years. Before colonization, there's at least 90% of our land is covered by forest. And the 333 years of Spain colonization extracted at least 20 to 25% of our forests. We're not talking about other resources yet. And then after 333 years, while we're fighting, dying, in the field, thinking that we will win our independence, we are sold by Spain to the US. And the US for 48 years colonized us, and within 48 years extracted another 20 to 25% of our forests, which took Spain 300 years. And then later on, left us with very little resources to defend ourselves from natural disasters, climate-related disasters, and there's a long story after American colonization, of course. I mentioned the climate change impact is very unequal, especially in societies that are very unequal. Often people from low-income backgrounds, people of color, are forced by societal structures and systems to reside in communities or areas where they're more exposed to elements. So therefore, they're more exposed to climate hazards and even the mental health impacts. And that's very true in the Philippines, where the gap between the rich and the poor is just very, very wide. So you see people living in, beside the rivers, in climate hazard areas. I'm not the perfect person to talk about climate justice, but I always think that this is very important to mention and to highlight, elevate even, that climate change is also gender justice. That when bad things happen, women often face the more severe brunt. COVID-19 gave us a lesson that when bad things happen, women have multiple layers of responsibilities. For communities that are affected by climate change, women often are more exposed to sexual and gender violence. We know in Africa that there are increased rate of child marriages, daughters being sold to other families when drought happens, because that means less mouth to feed. Climate change is also intergenerational justice, because young people today and the next generation did not cause climate change, yet they will face the worst severe consequences of the climate crisis. And it's just unfair, right? So it's important to reflect, how can you be a responsible ancestor, that your future generation or descendants will be very proud that you made the right and urgent decision. And we know that young people over the world experience all these emotions, because of their sense of feeling betrayed and because of intergenerational injustice. 31 years ago, while there's already discussion on environmental science, environmental studies, in the Philippines, Attorney Oposa, fresh from law school, sued the Department of Environment and Natural Resources Secretary Factoran of the Philippines, to stop the licenses of the timber companies in the Philippines. And he invoked intergenerational justice. He said he was representing his kids, the kids of his friends, and the next generations of Filipinos. And then the first question in that case was, can the future generations be represented in court? And Judge Hilario Davide said yes, they can be represented in court. And so eventually they won. And the point is, in the Philippines, 30 years ago, we already are talking about climate and intergenerational justice. And then later on, this very case was cited in many European and Western countries to invoke intergenerational justice. So I'll now move to the next part, and I'll try to make this quick. Time check. How many minutes do I have? 10?
10.
Yeah.
10. So you have good questions coming. If you want to cover them.
I'll talk about how to cope. Of course, the first part can be very emotional, so it's important to think about how we can cope. We know that when we give opportunities for young people and those environmentally minded people, opportunities to talk about how they feel, to be in groups like this where you can express your emotions, you begin to feel that you're not alone, because it can be overwhelming to think about this huge problem, climate change. We also know that engaging in climate activism, climate and environmental advocacy is a pathway towards recovery and towards better well-being. And there are also evidence that exposure to nature is very much beneficial to your mental health. For instance, do you know Shinrin-yoku, forest walk? There's evidence that it's actually beneficial for mental health. 30 minutes, 1 hour of forest walk. There's scientists in Japan that showed that some forms of chemicals from the trees, when they enter your body, it impacts your brain, and then from in a good way. This experiment among patients with depression showed that several weeks of daily walk in the forest decreases depression symptoms, sometimes lead to recoveries for some patients. Green space visits based on 18 countries. This multi-level study showed that countries where people are more frequently visiting green spaces and even blue spaces, they have better well-being. They have lower depression and anxiety scores. This experiment divided people into groups. One group walk for 1 hour in green spaces, one group in urban spaces. Then they examined, using brain scans, their amygdala. Amygdala is the emotion center of your brain. So when you're stressed, that highlights a lot. So after they are induced with fear, they ask them to walk in the forest and urban space, and you'll see that brain activity lowered when you are exposed in green spaces. So you're more rested and calm. I have a study where I looked at nature connectedness, your feeling of connectedness with nature. We know that it's connected with better well-being, according to Filipino samples. And I want to share, of course, there are many other evidence. We can talk about it later in the Q&A. But I want to share, and I'm always proud to share the things that we do to promote climate change and mental health. Nexus, for example, at De La Salle University, in my university, I founded and manage, I call it Sphere Lab, Sustainability, Psychology, and Planetary Health Research Lab. Students and colleagues working on research advocacy, and we will try to influence policy later on. But yeah, feel free to reach out. We have a LinkedIn profile. We also don't forget to work with communities. So Renzo and I are really partner in crime. We work with farmers, with rural communities to provide climate literacy and mental health literacy programs. We built a climate change and mental health community in the Philippines, a group of interdisciplinary experts, and also funders, government agencies, young people are there. We try to maintain that group. We also co-lead our project on connecting climate minds. This is a global project working on identifying the research and action agenda on climate change and mental health in 7 SDG regions. And Renzo and I are part of the core team, and we co-led the Eastern and Eastern Asia region. We can elaborate on that later, but acknowledging the global team of the project, we have excellent people all over the world. If you want to learn more, we have an article published in Nature Mental Health describing the project and our achievements and the next steps. But I'd like to close this presentation by emphasizing that it's now a right time to give more attention to climate change aspect, to mental health aspect of climate change and planetary health and health discourse. That when we talk about climate change and mental health nexus, let us not forget the historical and structural injustices, that are often forgotten. We can gain meaningful insights from the rich experience of people in the global south. We from the Philippines experience climate change in our daily lives, and we have very rich insights. And taking climate action is an expression of our commitment to climate, social, gender, and intergenerational justice. Thank you very much.
Excellent job. But I'm biased because you're my friend, right? So let's hear from the other colleagues before we open the floor or the table for this conversation. I just want to acknowledge some of our friends who are joining. Of course, in this room we have colleagues from different parts of the National University of Singapore and Duke-NUS Medical School. We have a friend here from the Singapore Management University. Online, we have friends from Singapore International Foundation, and others, but we also have, the Center for Asia Pacific Resilience and Innovation in Taipei, Taiwan. We have even the University of Karachi in Pakistan. We have several Filipino friends, of course, who are in the room. Different organizations, IQVIA, Ernst & Young, and we even have a colleague from Heidelberg Institute for Global Health. Good morning. It's very early there in Germany. We have United for Global Mental Health, who is one of our strong allies when it comes to promoting mental health advocacy worldwide. UNEP, the United Nations Environment Program. Very, diverse group of people actually joining us, even virtually, from different organizations, different sectors, different disciplines, and different locations in Asia and the world. And of course, before I forget, we also have colleagues from our regional collaborating centers in University Sumatera Utara, USU, in Medan, Indonesia, and also University of Jaffna in Sri Lanka, and Hanoi Medical University as well in Vietnam. So, Anne-Claire, do you want to start the ball rolling?
Yes, thanks, Don, for the amazing presentation. And I really like the fact that you also shared about the nature-based therapies, because there are more and more evidence showing that nature can help to address mental health like symptoms and conditions. So I just wonder, like in this climate and mental health discussion, how climate or mental health rates, like climate interventions, how they differ from traditional mental health interventions. What difference when you implement these interventions?
That's a very important question, because right now there's a great movement on promoting more climate aware therapists, because many of the mental health professionals are not yet aware of the mental health consequences of climate change. So there are trainings where they train mental health professionals to broaden their perspective a bit and be more aware of the pathways, causes, outcomes, mental health outcomes of climate change. So it's very important that a therapist is climate aware. But also there's right now it's still very early to think about very specific solutions. But what we do is we borrow already existing mental health interventions and apply them to very specific climate change and mental health cases. For instance, there's this literature review that examined existing interventions, the limited interventions applied on climate change and mental health. And one of the interventions is emotion regulation-based strategies. That if they teach young people, but it's limited so far on young people, how to regulate their emotions, they become less overwhelmed and they're able to take climate action. There are also evidence that mindfulness-based activities are also helpful in addressing climate anxiety. But admittedly, again, it's a very young area of research, and there's so much more that we need to learn. There's also a trend where funders become more aware of the climate change and mental health nexus. Then some funders are beginning to support studies about interventions specific on climate change and mental health. So we're aware, for example, Renzo and I are aware of Wellcome Trust, funding climate change and mental health.
And because you mentioned Welcome, I should charge Welcome, right? I'm making an advertisement. They're launching a call for research proposals on the links between heat and mental health, which
That's
is
correct.
an underexamined but again growing area of inquiry. There's one question from our friend Norma Tagaza from Heidelberg Institute for Global Health. Are there studies that link climate and mental health with, for example, alcoholism and drug addiction?
Yes.
Yep.
There's a group of environmental psychologists and public health experts in Australia. They have a paper on climate change and substance abuse. Because the idea is when bad things happen, because of climate change, people find ways to cope. And sometimes coping mechanisms are maladaptive. And one of those coping mechanisms would be substance use. Of course, at first blush, they're very far. It's very difficult to think of climate change and substance abuse. But there are some connections, apparently. This is still a very new area of research. So I would suggest that you find this study. It's not actually a study, it's more like an integrative review paper on climate change and substance abuse. But in terms of really specific evidence, I would have to say it's still growing in beginning.
Anyone in the room?
I do have a question. Hi, Benzon. I call him Benzon. Might reflect the pace of life when we met. But yeah. So I'm Yasmin. I'm from Singapore Management University. I'm a sociologist, not a psychologist, but also from the Philippines. I was curious, like you mentioned coping. As a migration scholar, there's all these studies on actually how people don't move. I think the INGOs are a little too obsessed with people who move due to climate, but actually the vast majority do not move, whether it's drought-stricken farmers, fishers in coastal areas, they actually don't move.
Yeah.
And I wondered, I always wondered, is it helplessness? Is it coping? Are there any studies on this, and how would psychologists make sense of it?
I will answer that as a psychologist. And there's a term we call place attachment. Some people are really attached to the place that they can't imagine themselves anymore residing in another place. For example, even most especially indigenous studies would suggest that when indigenous people are attached with their ancestral lands, they won't move, except for the indigenous nomadic people, right? There's also, for example, an issue in the Philippines. You may be very aware that some people, when they're displaced and relocated, through national housings, they still go back because their livelihood are there. They cannot survive to their new housing location. So those are some of the reasons. But my answer is limited to my view as a psychologist, and I'm curious as a migration scholar, what else do we know? But there's an emerging research on climate migration, and I'm curious whether we can do something on climate migration and how it impacts mental health, before and after, during migration. Because we know that in 2050, 2100, because of IPCC report, based on IPCC report, we expect millions of migration, especially in island countries in Southeast Asia.
This is very interesting because Tanisha and I are finishing a report this week for the World Health Organization on the nexus of climate migration and health. And there are, it's not a monolith, right? There are many different types of migrants. You have migrants who move because of climate change, and they will have health issues, both physical and mental. You have migrants who already move regardless of the reason, migrant workers, and then now they're disproportionately affected by climate. And then this third group, what we call trapped populations.
Right.
That's one term, trapped populations. Another term that is now emerging in the literature, immobility, right, due to climate. Or not due to climate, but because of the circumstances where they are in, they really want to move. And so on one hand, maybe they're so attached, or on the other hand, they really want to move, but they can't.
Yeah,
because they just don't have the resources. And I'm reminded of, I was just talking to someone last week when I was in the Philippines, and their house, for example, were frequently flooded, and then eventually they realized, oh, it's time to move. But their neighbors cannot do that because they do not just have the resources. So it's very interesting, and I think that's where psychology meets sociology, right? Trying to unpack how our individual biases and mindsets interact with the social structures.
So now, for example, in the Philippines, in Bohol, in the Philippines, there's this community. Like 10 years ago, it's their community, there's still land, but now they need to boat to go to their neighbors.
Wow.
And the kids would go to school sitting on the chair, and their feet are on the sitting on the table, and their feet are on the chair because it's because of sea level rise. And some of the interviews with the members of the community showed that they wouldn't move because their parents were born there, they were born there, and they don't wanna. They would like to die there. Their livelihood are there as well. So it shows, place attachment, and also what you mentioned earlier, immobility, but also, I don't know. It's like their very identity is tied to the land. Yeah.
Any questions?
So, I'm Daniel, from NUS. I'm just wondering, so we already have a health-seeking behavior problem around like mental health. How from a psychologist's perspective, what's your opinion? How it differs? How it differs between climate-induced mental health? Is it these people who experience mental health problems due to climate do they seek help or they're not?
Yeah. Very complex. It's a simple question, but I imagine there's a very complex answer to
Another
that.
doctoral dissertation.
Yeah. We know mental health in itself has a lot of barriers, for seeking help. Stigma is there, especially in more traditional societies. Stigma is definitely a barrier. In the context of climate change and mental health, of course, stigma still applies, but also we take into account that climate change is a very politicized issue as well. There are a lot of climate deniers. We know in psychology studies that climate change belief is an issue. The people are divided in terms of their views of climate change. So how do you now navigate that? If you experience mental health problems because of climate change, you tell people, I have mental health problem, I'm afraid of climate change. But this is a society where views are very polarized and divided in terms of climate change. I don't know the answer, admittedly, but I imagine it's a very complex place to navigate. Yeah. So some of the solutions I imagine would be, of course, I can say climate change awareness and mental health awareness programs, integrating mental health and climate change in basic education, community programs, etc. But it has to be more of a multi-level systemic approach.
So we have 10 minutes remaining and we have more
Yeah.
questions coming from our online audience.
So we have a question from Makila from the Center for Asia Pacific Resilience in Taipei, asking about the indirect paths of climate anxiety. That seems a bit more difficult to pinpoint. And the question is about how we can properly identify and address these issues. And are there any community-oriented ways or pathways to create safety networks for people impacted by indirect climate anxiety?
Let me check if I understand the question
Yeah.
correctly.
So more about community safety networks for people who are impacted by climate anxiety.
But the first one, I think, is again about the pathways.
Yeah.
I think it's a bit of a scientific question,
Yeah.
right?
There's also maybe a joint question.
The third one.
From Kavita Palanyapan, who is from Duke-NUS, and she's asking about example of successful community-based intervention that have improved mental health outcomes in climate affected regions. I think both
Okay.
are looking at
Many questions. Number one, pathways. It's a very early area of research, and of course, Renzo knows this very well because one of the first global project on climate change and mental health, one of our agenda is to identify the pathways, because we know that there are psychological pathways, there are sociological pathways, and many different structural pathways from climate change to mental health. We beginning to realize that for us to address the mental health impacts of climate change, we need to understand the pathways. And understanding the pathways requires an interdisciplinary approach, even multi-sectoral approach. And that's why many of the studies now and even funders encourage that studies focus on understanding pathways. Because, for example, different climate hazards may have different pathways towards mental health. Heat has a different, it's different from typhoons. It's different from air pollution. So pathways are really complex and different. We imagine that in the next 10 years, we'll have more understanding of the pathways. Yeah. And the next question is
Community.
community and
approach.
safety networks and community-based intervention to address it.
That's a very good question. I know that I would like to share one of my projects that I did, where I developed mental health interventions for environmental defenders. They're very prone to climate anxiety and other mental health problems. And I described earlier the dangers of being an environmentalist in the Philippines. It's a next layer of mental health threats. So I developed these two interventions, one individualized pocket size intervention they can access anytime they want, whether they're in the field, and a group intervention. Right now, we're still at the part where we are piloting the intervention, and we're learning that somehow it's helpful, but there's a challenge for us in that particular project because the interventions were written in English. We translated it in Filipino, but so far it's challenging because there are at least 200 languages, around 200 languages in 7,000 island Philippines. So the translation and the implementation of that intervention becomes challenging and would require several iterations. I'm aware also of other interventions done by other organizations. There's this organization we know, Renzo Climate Mental Health Network. It's a US-based organization that's really niche, focusing on climate change and mental health. You can visit the website. They develop a lot of tools that's free to access, for young people, for adults, for teachers, for communities. They have rich tools. So if you wanna access many interventions that are being tested now, that's the Climate Mental Health Network.
Yep.
Yeah.
Yep. I think that's a great answer to one question from Dante Otara, who's a Filipino MPH student from the University of New South Wales in Sydney, is asking for tools for physicians, general practitioners. So I think
Mhm.
that answers that, right? That question. Visit the website, but also connecting climate minds. We also shared the link here in Zoom. We'll share it also with the people attending
course.
in person. We just have two very quick questions.
So we have one question about like nature-based prescription, and how this kind of like intervention are perceived in the region. So using nature, like you mentioned about like forests, in how Asia, is taking on this kind of program.
So that question is from Charlotte Hicks from the United Nations Environment Program. And then the second question from Stephen Walker from ID Insight, which is about education, right? And how can we, in a way, revise education to make climate resilient and psychologically resilient citizens? I remember that's one of our dream studies, right? To check if climate education is empowering or paralyzing.
That's true. That's true. Honestly, I'm not aware of nature-based intervention, the mental health nature-based intervention that exists in Southeast Asia. I'm not saying there's none. I'm not particularly aware, but there are some groups that informally would go to the forest. For example, our friend Ruben would at one time invited me, let's just go and walk in the forest. And then you, the psychologists, tell us what's happening, as we walk. There are those informal, but I'm not particularly aware of any formalized intervention in Southeast Asia, but we definitely have rich, landscape that we can maximize here in Southeast Asia. To answer the question on education, Renzo and I have been dreaming the past 2 years about climate change education and how we can nicely integrate that into basic education. But we worry that if we do that, it has to be done in a way that's hopeful, empowering, rather than paralyzing. Fear-based education can paralyze young people and then therefore make them overwhelmed. So how can we teach that in a certain way? That's a question to a question.
Yep. And I think what we're realizing from this conversation, this is a new area ripe for inquiry and scholarship and innovation, right? And we have some colleagues also from the innovation team here of their institute. Let's close this event, not with fear, but with hope and optimism. Thank you, John, for presenting the evidence. Thank you for sharing with us the linkages between climate and mental health, and also for giving us a glimpse of what we can do and what are the many unknowns that, for example, our young researchers listening virtually and even here in person would like to may pursue, right, in the future as part of their scholarship. And of course, thank you very much, Anne-Claire. Lovely co-moderating this with you. And again, this is an agenda that we also want to really grow within SDGHI, bringing the joining of forces, between mental health and planetary health. And again, lastly, thank you to our audience in person. We'll enjoy our lunch shortly, but also to our still around 70 participants online staying with us. Thank you, and please join us in our future conversations in planetary health. Take care. Let's safeguard the health of both people and the planet. We finished on time.